Hi guys, I hope you're doing good. It's your girl Alina, and this is simply my views. If you missed my first video on the cost of mental health cost in Namibia, please check it out because this is part 2 of that video. Okay, so in that video I mentioned quite a few things. I won't be repeating them, but I also didn't manage to include other things that I found that are kind of very important to note down when you're looking into mental health treatment in general. So, like I said, it's multidisciplinary, requires a lot of experts to deal with it. There is not like one antidote for this and that. I mentioned and emphasized on the services that are available in the state because a lot of people, the reason they are even asking for the cost is because they think they are everywhere it's expensive and you have to pay a lot of money. But I already said in that video that at the state it's really free. But I forgot one important aspect, that these hospitals, especially the central hospital, and I believe this is the same case as the Oshakati hospital, they are referral centers. They did indicate that they will welcome if you walk in, but those are on very like it's a few cases that they are welcoming. You need to go through and any health unit where you will be diagnosed, or potentially people will spot the symptoms and refer you there. Most health workers are able to do that and pick up the warning signs and refer you to the right department. And I personally also found myself there. I know for sure that's where the help is, but I also had been referred there by a professional. I hope that helps. Like, you can literally walk in the nearest clinic near you, or the nearest hospital, state or private, as long as if you are referred to a psychiatrist, and then maybe they give you, if you are in the private sector, mostly they have a list of specialists where they forward you to. But maybe you feel like you cannot afford it in the private sector, you can then go with a referral letter to any of those centers that I mentioned that are in the state. The other thing that I also left out was the fact that when you are on treatment, when and if you are on treatment, but because not everyone is on medication, because there is the psychological aspects where you just go for counseling. There is social the aspect, and then there is now pharmacology, or I'm not sure that's the right term, where you get prescribed medication. You may be familiar with this because some of you, if you've been depressed or you had anxiety, have received something like antidepressants and all those things. That's the medication that we are talking about. But not because we have so many mental health conditions, we are not all going to end up with antidepressants. You'll get the medication for your unique condition. So the cost of that medication, it's almost similar with the cost of seeing a specialist or a professional to treat you. In the public sector, or in the state hospital, you will get the medicine for free. I have personally received that dispensary at the hospital here in Central Hospital for free, because that's where I get my treatment. But if you're also in the private sector, or even if you just have maybe medical aid and you can afford to go to the pharmacies with your medical aid and claim, you can also do so. Those medications may be available at local pharmacies and you pay for them, but they are really expensive. I will not lie. Mental health conditions are categorized as chronic conditions. If you have a medical aid, you will realize, or if you haven't maybe looked into this, there's something called like the way the medical aid is set up is such that there is different departments that health providers can claim from. For example, when you go to your to your GP every day, that is called day to day. Like they claim from a day to day. I also found out that even psychiatrists are included in day to day. And then there is something called acute medication. This is your normal medication when you have a flu, a cough, or whatever. That's where they claim from. And there's on each thing, on each department, there's a certain limit of how much money is there. So if your treatment exceeds the amount that is allocated, you will end up having to pay cash. This is where your medical aid, they say it has been depleted. The funds that were allocated there, it's been depleted. And medical aids are not the same. For example, if you work for a government and you have a government medical aid, and there are others like NHP, NMC, this is now in Namibia, and others that I'm not aware of, your benefits are different because even your contributions are different. Also, even if you're all, for example, on CMS, which is a government medical aid, there are options like you're on a standard option or you're on a high option. That affects how much benefits you have. I won't go in the details on that because I'm not speaking on behalf of the medical aids. It's just that it factors in your treatment when it comes to mental health, because now your medication, or if you get the medication for mental health conditions are not coming from your acute medication. There's something called chronic medication, and it's because I think they are aware of the prices of the chronic medication, that the allocation for chronic medication on most medical aids is higher than that of acute medication. Let me give you a feel of how much money we are talking about. For example, when I just started, I was on a completely different medication than that I am on currently, and that one was costing over $1,000 for just one medication, and I had to take more than one. Like there's this box where you take maybe once a day, and then there's another box where you take how many times a day, and those you are supposed to have every month. Like you get every month. I used to get every month, but sometimes you just get for a week because maybe the drug is new and is being introduced in your system, and they need to monitor how you are responding, because mental health treatment does not have an exact, like you walk in a pharmacy and ask for a flu medication, you get a flu medication. We can even all have the same diagnosis, but we will not be on the same medication, because humans and our bodies respond differently to those drugs. And also it also depends on the severity of the condition. For example, maybe you have a depression, but your depression is not severe, so you don't need a strong dose. Maybe you are on this medication, let's call it medication A, and maybe you are taking 100 milligrams once a day. And someone, maybe the condition is too critical, they need a stronger dose, they will still have that medication A, but maybe 300 milligrams. That's why it's not encouraged, it's not even allowed to share medication just because you think you all have depression, or you still think you are all having anxiety. You need to go to a professional and get your own prescription if you need one. They will know if you need one. And the other thing that I also, this is a very sensitive matter for me because it still gives me flashbacks when I talk about it. It's the fact that, just like I'm emphasizing that there is no specific drug for a certain condition. Let me be open and say that I do have, my condition is called bipolar disorder. So sometimes you can be manic, and the other time you can be in a depressive mode. You are more than welcome to just Google what bipolar is, So my treatment was not at all easy, or even it was just not easy. What happened is I was I was manic. My first episode, I was in a manic state. So now that manic state needed a certain dose. Now how they treat whatever your symptoms are, mostly they try to stabilize the symptoms first, and once you're stable, then they see what is best for you. I got a certain drug, I will not mention it, and then they had to monitor for like a week, like closely, to see if I'm responding positively or negatively, because sometimes you will not even respond. Then that is already a sign that maybe this drug is not suitable for you. They are going to do a trial and error on you. I do not think this is anything wrong, because the way it was explained to me, it's that's just the way it is. So I accepted it. I do not understand beyond that, but that's what happens. Like, they would put you on a drug that they know is suitable for this condition, and they will monitor closely how you are responding to it. If you respond positively, then that's good for them. If you do not, then they have to try another one, and they cannot leave you untreated, because you need to be stable to function and just to be okay, because it's also just a health condition that needs treatment like any other. So, and then those trials, there are side effects, ne, that are really not beautiful, and I've gone through the most with those side effects. They tried one medication, and I just lost muscle control. I was shaking uncontrollably, and they had to inject me with something to undo what that drug did to me. There are others that are really uncomfortable, and I'm not gonna share them on camera, but they were really rough. The highlight was the one that made me to be unable to stand. So I had to be wheeled into the hospital, like I was literally on a wheelchair. I wasn't documenting that at the time because I was in no shape, but this is something I remember like it was yesterday. It was 2 years ago, 2019. It will be exactly 2 years in November. And yeah, the treatment is a whole thing on its own, the medication and all that. So when you go looking for treatment, maybe you need to keep an open mind. Be willing to hear what the professional are saying, because if you yourself are not welcoming that treatment, you may even start, maybe you get the tablets from the hospital and then you are not drinking them, then you will not get better. There's nothing wrong with taking medication. I know people are shading people, even people on ARVs and whatnot. Those are just normal treatments for the person to go on. It's your life, ne? You need to take care of it. People can mock you, but they won't live this life for you. Yes, it's very painful. I have lived it. I've been shaded. I still get very insensitive comments, but I stand here to encourage you that there's absolutely nothing wrong with you. There's nothing wrong with getting the help that you need. So go on. If they tell you you need to come back in a week, go back in a week. They will monitor you. If they say you need to come back for pharmacy to collect your medication, because they won't give you medication for 6 months at once. They'll give you medication maybe for a month or a week or 2 weeks, and then they'll say come back again. They have their own reasons for that. That's just how the things work. You don't need to understand. So I said earlier, it was very expensive. And then there are other challenges again in the health system that may affect the treatment of mental health, especially I remember very well in 2020 when COVID was hit, and there was this delay in delivery of goods and services, since most of our things really are just coming from outside our borders, including those medication. There was a point where there was no medication, not that I was aware of, like it wasn't there. There's nothing wrong with the health system, please. I'm not here to paint a big picture about our health system. No, the health system is doing good. This is the reason I'm still standing here. They have helped me, they are still helping me, but that was one big challenge. Now the implication that comes with the medication not coming, it means most of us depend on those medication to be okay, to remain stable. So if there's a delay and that medication won't get to me when I need it, say my dosage that I got last month is finished, there's a very high risk that I will go back, I will relapse. Like I'll start having those symptoms again, and I will be out of control. Things that the people are calling you going mad or whatever, it's not madness. Sometimes it's just untreated mental health. Okay, I remember very well that I reached a point where I have called every pharmacy outside the state, because the state also didn't have. I asked for a prescription from my psychiatrist, who is from the state, and I said, let me go look at other pharmacies in Namibia that are not from the state. Like, I live in Windhoek, there's a lot of pharmacies. I can't name them, but I've gone to all those pharmacies and they said, no, we don't have, we are out of stock. So, and I was lucky because I could access the medication in a private sector. So if they had, I could have just bought. But I will let you know that if you there are a huge number of people with those conditions that cannot even afford to buy that medication for themselves. As much as they know that it's needed, as much as they understand how important it is, but their socio-economic conditions do not allow them. Because even just to get transport to go to the hospital is an issue. Imagine now going to buy a drug that is 800, 1,000 or more. Just imagine that. So guys, there are a lot of factors that are involved in treating mental health. Costs, side effects, you name it. The experts will tell you. Just just seek help. It's okay. I've sought help, and the reason I'm standing here sharing this information is I want as many people that are out there not saying this out loud. I know they are watching. I've had so much engagement on my phone, people coming to say thank you for sharing that. That tells me that there's a lot of people that need this information. That's why I keep making the information. Share this information with people you think they may need it. Direct them to the right department. I may not have all the answers, but I believe what I'm sharing here is important. It is going to help someone. To be completely vulnerable out here sharing all this is not easy, especially with all the stigma and everything that comes with just talking about mental health. There is still people that feel like maybe I'm not stable, that's why I'm talking, like, yeah, stay away a bit from talking and what and what and what. They have their own opinion. They are all important. I just don't know how to assimilate them. I thank you very much for staying here and hearing a little that I had. I'm still going to encourage you to go to the centers that are available for you to help. And don't worry about if you don't have money. Turn to the state. I will tell you, our health system here in Namibia is really there. Please go there. Go to the nearest clinic. There are usually social workers there. If there is not, there will be someone that will point you or will refer you to the referral centers that I kept talking about. Thank you so much, guys, and I'll see you next time. Goodbye.